This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We've been talking about addiction today, first heroin, and as we learned many times, a heroin addiction starts with a dependency on pain pills.
One of them, the narcotic Oxycontin, is considered a strong drug and highly addictive. Oxycontin is often prescribed to people who have chronic pain that can come along with certain types of cancer, for instance. Thing is, even if a patient takes the medication as prescribed, according to Narconon, they can still become addicted by building up a tolerance. Eventually, that person will need more of that drug to ease their pain, or may turn to something else, something a little more cheaper, heroin.
So it may have taken you by surprise when the Food and Drug Administration recently approved Oxycontin for kids ages 11 to 16. The FDA says children can use Oxycontin only if they need long-term pain relief and have no other options. The drug will be used for patients with cancer, trauma, and those recovering from surgery. Now, some pediatric cancer doctors have expressed support for the decision, but as you can imagine, there are also many concerns.
So joining us today to help iron out some of them is Dr. Dae Yim, a clinical pharmacist with PRMC. Dr. Dae Yim, how are you?
Good, how are you?
So first off, I just want to get right into it. Why prescribe such a powerful drug to children?
FDA just recently approved Oxycontin for the cancer patients as well as life-limiting disease such as leukemia and bone marrow transplant patients who is only taking Oxycodone 20 milligram a day or the morphine 30 milligram per day, which is chronically patient has been taking those opioids, will eligible for the Oxycontin. 90% of the patient out here, we do have a lot of the acute pain-wise. Oxycontin does not taking care of that one.
So what's the difference between Oxycontin and Oxycodone?
Yes, there's a lot of the confusion about that one. Thanks for the asking that one. Oxycontin is designed to release over 12 hours. The Oxycodone is when you take it, it will kick in the system like 20-30 minutes. So majority of patients in the community out here, around about 90% of patients are acute pain. That's the reason why it's Oxycodone, which immediate release will be a better bet than Oxycontin.
So Oxycodone would be used for like a broken bone or something like that, the immediate release, where Oxycontin would be more chronic pain.
Correct.
What are some alternatives to these drugs?
Alternatives, I would like to go with the first one is non-steroidal anti-inflammatory drugs, which we call the ibuprofen, Motrin, and the Advil, as well as the Tylenol. It will be the first my choice, because I would reserve the recommendation for the narcotic for the last resort, because that's the one, like you mentioned earlier, that is addiction potentials.
Yeah, another medication is codeine, but that's kind of under fire as well. What are your thoughts on that?
Codeine is not really good for the pain control. It has been formulation to control the cough syrups and as well as the pain control. However, codeine, it goes to the liver, turns to the morphines. So when you control the pain, it really delay onsets. So and also 2012, there was 3 pediatric patients died because of codeine overdose. The postmortem autopsy shows that those patients are the fast metabolizer, which means your body is completely convert the codeine to the morphine almost 100%.
So it all comes down to how a patient metabolizes, their liver metabolizes.
Correct.
So it's not a one-size-fits-all.
Correct.
Okay.
So always kids-wise, codeine, who's on codeines, you have to really watch out for the respiratory drive, because it really coming down to the 10% with the populations are fast metabolizer. I mean, you don't want to take that chance.
Right. And of course, what should parents keep in mind when it comes to giving their children any kind of medication, pain medication?
First of all, you have to look at the label first. Manufacturer put out the safety guidelines and the dosage formulations, how many times you give or what do you look out for it. So my first inclination to ask your healthcare providers as well as the pharmacists over the counters, when you buy the products, ask them what to look out for it and what is your safe guidelines.
So follow the labels and be informed. Dr. Yim, thanks so much for joining us. And if you want to read more about PRMC and Oxycontin abuse, or to read more about the FDA's recent decision, go to our website, wboc.com, and click on our picture at the top of the page. Well, from protecting our children to protecting the streets of Delmarva, coming up next, it's another batch of Most Wanted Monday. See if you know any of this week's fugitives. It could mean cash in your pocket. Delmarva Life, we'll be right back.